So TeleVox is a omni-channel digital patient engagement company. We provide software to over 10,000 healthcare provider organizations, payer organizations, pharmaceutical companies. And ultimately, we allow patients to digitally engage, get educated, and empower them to do activities that they need to do engaging with these organizations. So I think from a patient engagement and experience perspective, health systems face many challenges today. Fundamentally, a lot of the processes today are manual, phone-based, calling and handling by staff, can't be executed cost-effectively at scale. So I think that is the fundamental challenge. And what that leads to is a poor patient experience where all of us have gotten used to, consumer experience in different verticals, but we are not able to do the same kind of, self-service when it comes to engaging with our health system. Which leads to poor care as well as poor experience for me as a patient. And then from a health system perspective, they have high cost. They have maybe even they've implemented point solutions around area, but it's really they have a high cost. They have revenue leakage. As an example, if I'm a patient and I can't cancel my appointment that easily or reschedule it, I may not just show up, which means I was a no-show, low revenue. If I'm not prepared in the right fashion for colonoscopy, with the just-in-time sort of education on what I should be doing 3 days prior, 2 days prior, I might show up and that procedure would have to be canceled, leading to, again, revenue leakage and a bad experience for the patient. What makes TeleVox really different is, firstly, we are, powered by experience, right? We've been serving healthcare for 30 years. We have over 10,000 healthcare provider organizations as customers. So we've really learned what works, what doesn't, and we can bring that best practices to bear for our other customers. Secondly, from a technology perspective, we now have a platform that can address many of those use cases and interactions that patients do with health systems in a more self-service fashion. So it's really not a point solution, it's a platform. And then finally, it's omni-channel. I can communicate with patients where and how they want to communicate, whether that's SMS, whether that's automated voice, whether that's over the web. Yeah, at HIMSS, we are very excited to launch a new solution we call Iris, which is a omni-channel AI-powered virtual agent that does a few things for the patients. It allows them to self-service and ask questions from content that already exists, let's say on a health system website, and they're able to quickly get answers and accurate answers from that. Secondly, it allows them to self-service when they want to do that, through the website, through SMS, through phones. For a variety of tasks, whether it's appointment management, whether that's refills of the prescriptions, without having to log into systems, remember passwords, etc., all in an easy fashion. So we are very excited to bring that to market and meet patients the way they want to communicate with health systems. So yeah, conversational AI is a very hot topic these days. A lot of people are trying to do things in that area. And fundamentally, there are 2 or 3 things that differentiate us. Firstly, we leverage the existing content, like the website that already exists for the health systems. They've invested a lot of time and energy in building that content. Where historically previous, chatbots and things failed or are hard to maintain because you have to keep updating that content and make sure that is relevant. We don't have to do that. We can set this up in 15 minutes. You don't have to touch that again. We leverage the content. So that's a big value. Secondly, we are EHR integrated. So not only is it about just information, patients can self-serve and finish certain tasks because we are deeply integrated into EHRs like Epic and others. And finally, it's omni-channel. So whatever I can do over the web, I can do over SMS, I can do over phone. A lot of other solutions are very limited in one, maybe they have a web chat bot, but can't really handle SMS communication channel as well. So how quickly can people see value or health systems see value? We are very ROI focused. So we really ultimately look at any workflow or any activity we do through the lens of ROI. And health systems can implement that very easily and see value within weeks rather than years with some of the other technology solutions. And typically, we're targeting ROI of 10x to 100x kind of ROI for our customers. So what kind of ROI health systems see? So I think digital patient engagement that can be automated and engage patients through self-service, where you don't have to devote staff to handle those kind of manual processes, is a very high ROI. And typically, any workflow or any activity we do, we typically are able to deliver 10 to 100x plus ROI for our health system. So again, as a product leader, when I look at doing new things, I want to make sure that any feature, any capability I'm delivering to health systems delivers that kind of ROI, 10x to 100x over that time period. So at a personal level, what motivates me and our team is really to be able to, help a large number of consumers or patients in their, healthcare journey. And secondly, what motivates me is to bring interesting technology to market that helps customers, or in this case, healthcare organizations, meet their goals, which is improved financial performance, more revenue, more efficiency, as well as driving better care and outcomes for the patient. So it's a very exciting time in healthcare, and I personally have devoted kind of this stage of my career to building technology and bringing to market those kind of solutions for our customers. So as I look at CIOs of health system organizations or leaders in patient experience and patient access, as a solution provider that has a lot of experience working with many health systems, really there will be three pieces of advice or areas I would ask them to think about. One is from a technology perspective, look at platforms, right? You probably have many applications that are point solutions, and having platforms that can do many things allow a better experience to the patient side, as well as lower cost and management for yourself. Secondly, think of ROI and revenue. A lot of people look at technology and say, what is the cost of that technology? I would encourage you to think about what additional revenue you can generate, what is the ROI, and then monitor those implementations to make sure you're actually driving and achieving those revenue and ROI goals. And finally, look at companies that are partners that have longevity, that are willing to work with you. We are a very profitable business, as an example, have been around for 30 years. We're not just a startup that might be here today and might have some cool stuff and disappear tomorrow. So again, look at experience and scale of the partners that you want to engage with, so that they can really work with you closely to meet your goals. So those would be the three pieces of sort of counsel and advice I would give.